So very good morning, friends. So is this visible? Is audio and video clear? चालू हो गया मैम, कर लिया मैंने. So good morning, guys. I think it's solved now. Okay. Uh, Sorry for the late due to few technical errors. It was not displaying our PPT screen. Okay, but now it's okay. So without waiting for anything, let's start, guys. Okay. So very good morning and welcome to Unacademy. This is Abhijit, and today we are going to discuss the second part of circulation. Okay. So in the chapter, we are going to discuss the how the circulation occurs inside of a body. Okay. So in last lecture, we already discussed how the heart work. Okay, and signaling in a heart, uh, the nodal tissues which makes a heart a myogenic. Okay. So in this lecture, we are going to discuss how the pumping occurs, the blood which is coming out of the heart and the moving inside of the heart. So this type of information today we are going to discuss. Okay, so guys, if you do not have subscribed the YouTube channel, please subscribe this YouTube channel. It's a Crack Maharashtra CET. The channel is for only a CET, or you can say the syllabus of complete 11 and 12 on this channel in very detailed format. Okay, so if you do not have subscribed, please subscribe it. Before starting the lecture, it is very necessary to discuss about or to know about me. Okay, so this is Abhijit Madkar. I have more than 6 years of experience in biology. I also cracked NET CSIR with all India rank 60 in December 2016, and it's from the life science. Okay, so this is India's largest platform, the Unacademy. If you want to be a part of Unacademy, it is very necessary to join this app or to install this app and sign in with this. So you will have the different type of lectures and the different educators on this app. Okay, so this app is available on your app store, so you can see your mobile app store. So app is available there. Okay, so this is a Telegram app. If you do not have Telegram, it is necessary to download it from App Store and then type this link or the URL in the search box. So you will have the one group and join option here at the bottom of the screen. And when you click on a join, you will be the part of this group. So what is there on this group? So this group is for the daily update. So which lecture is the timing of a lecture, the topic of a lecture, the subject of a lecture. So daily update is here on this Telegram group. Okay, and these are the subscriptions, the facility, the extra facility for you. If you want to take a full advantage of Unacademy, it is necessary to take a subscription uh, from this 4 5 at times. Okay, so these are the different periods, so you will have the subscription. So if you are in 11th, I will recommend you take a subscription of 24 month. The fees for 24 month is 24,000, and if you use this magic code, it will be reduced to 21,600 only. If you are in a 12th, so take a subscription of uh, 12 month. So the fee for 12 month is 16,500, and with a code like Abhijit in a capital, it will be 14,850 rupees. And if you already completed the 12th, so the student has a chance for the 1 month subscription. The fee for a 1 month subscription is 3,000, but with my code, it's only 1,499 rupees. So guys, if you do not have subscribe it. It is a necessary to subscription to unlimited use. Okay, so the what is unlimited? So the offline facility is there. You can arrange the session with your favorite educator. The doubt solving or the dedicated doubt solving session is there, and also the MCQs practice and the analysis. The where you are uh, going faster or the slow. So the complete map of your study can be analyzed on this app. So it is necessary to subscribe it to analyze yourself and to analyze the things which are necessary to crack the exam. Okay, so let's start with the human heart and blood circulation. Guys, it's a part 2 for us. Okay, so today we are going to discuss the part 2. Okay, in part 1 we already discussed the internal and external anatomy of heart. Anatomy of heart. Okay, so this external anatomy are sometimes called surface anatomy. Okay, so the in part 1 we already discussed this type of things. If you do not have the uh, knowledge or the if you require the revision for this part, it is necessary to see your first part. So if you do not see or if you do not study the internal and external anatomy, so I will recommend you please see first this part 1, and then start with the part 2. Okay, so this is a part 2, human heart and blood circulation. So today we will have the type of circulation and the how it occurs, and the very important thing, the direction. Okay, and tomorrow at 7 p.m. Okay, so tomorrow Saturday 7 p.m. we will have the same session like a part 3 for the different things like diseases and malfunctioning. So the abnormal functioning of heart, and then diseases with respect to the heart attack and arrest, and the malfunctioning in the myocardial muscles. Okay, so this type of information we will discuss in the part 3 tomorrow. Okay, and there is also the vessels like artery and vein. We will discuss the structure of artery and vein. So this type of information we will discuss tomorrow. Okay, so let's say working mechanism of heart. So what is meant by systolic and what is meant by diastolic? It is very important. So I take the uh, first slide with few concepts. Okay, so it is like a revision of your first session. So systolic means a contraction of heart, we call it a systolic. Okay, and diastolic means the relaxation of a heart. Okay, so you already heard this word. I know that you know the blood pressure. Okay, so the it is always in a systolic and diastolic format. Okay, so what is meant by systolic? When heart contract, the systolic blood pressure you can see, and when heart relax, the you can see the diastolic blood pressure. Okay, so the systolic is always greater in a number, and diastolic is always lesser in number. Okay, so the if you see the systolic means systolic blood pressure is a 120 and the diastolic is a 80. Okay, so that's why you always write it like a 80 and 120 because of this systolic and diastolic word. Okay, so is there anything you want to ask or you have in your mind? Please ask me. Okay, so the alternate contraction between atria and relaxation, we call it a rhythmic cycle or the cardiac cycle. Okay, we call it cardiac cycle. Alternate contraction between atria and the ventricle. Okay, alternate contraction and relaxation between atria and ventricle, we call it a cardiac cycle. So the one cardiac cycle is equal to one contraction plus one relaxation. So this is called as a cardiac cycle. Okay, so one cardiac cycle is one contraction plus one relaxation. So it takes about 0.8 second to complete the one cardiac cycle. Okay, so 0.8 second for one cardiac cycle. We call it a one beat. Okay, we call it a one beat of heart. Okay, so we know there are 60 seconds in a minute. Okay, if you see not a single complete second is required to complete the one cardiac cycle. Okay, so that's why for 60 seconds it is always more than 60 and the heartbeat or the cardiac cycles are 72 per minute, and that's why we take a value like a 72. Actually, if you see, it is slightly less in a male and it is slightly greater in a female. Okay, but still we use a 72 per minute because it's a 0.8 second to complete the one cardiac cycle, and if you calculate the 0.1 second for one cardiac cycle, so how many cardiac cycle in a 60 seconds? So the answer will be a 72. That's why we take a 72 beat per minute at a rest. So the very important word here is at rest. Okay, we know the condition change when the environment or the condition changes. At that time it will result into the change in a heartbeat. Okay, so the change in environmental condition will result in a change in a heartbeat. Okay, why slight difference between? So guys, we have one question, the very good question. So let's see what is the question. The question is why a slight difference for the male and female. Okay, so the your friend is asking like why there is a less heartbeat in a male and more heartbeat in a female. Okay, so here is a female and here is a male. Okay, so there are many reasons. If you see in a male there is more lung capacity. Okay, in a male. Okay, lung capacity is more. If you see the breathing rate, it's slower or it's less in a male because of the high capacity it required uh, the less or the normal breathing rate. But if you see in a female, what happened, the lung capacity is a slightly smaller, and due to the smaller lung capacity it required a slightly higher breathing rate compared to the male. Okay, so the lung capacity is about 6 liter for a male and it's about 4.5 liter for a female. So that's why there is about 1.5 to 2 liter difference in a male and female lung capacity. That's why the breathing rate is different. Okay, so there are different organs in a male and female, and they shows the different difference in a size, shape, and sometimes the rate of working. Okay, so if you see the bodies of a male and female, they are completely different, or the difference in their size and shape and because of there is this little difference. Okay, if you see the hemoglobin concentration or the blood or the volume of a blood in a male and female, it is also different, and because of that what happened guys, uh, a female required more heartbeat and male requires a less heartbeat. Okay, so this is a normal, this is the adapted value in the course of evolution. Okay, so there is a difference and there is a sure the reasons behind that. Okay, but not a single reason we can or I can explain the as a result of a 72 is not in a male and female slightly less and slightly higher than a 72. It is not a single uh, a reason. Okay, so there is a set of reason, and under that we can say yes, it is correct that less than 72 and more than 72 values are for male and female respectively. Okay, so let's see. Atrial systole. So now in this slide, atria is going to contract. Okay, systole means contraction. So now here atria is going to contract. Right atrium receive deoxygenated blood. So we know that here you can see the right atrium which is receiving deoxygenated blood from the lower part of the body. We called it inferior vena cava, which is coming from your um, kidney. Okay, so the it is come from your kidney toward the liver and then coming toward the heart. Okay, so this vena cava coming from the different part or the which collect the lower body blood, and the superior vena cava which collect the upper body blood. Okay, so what is mean by lower and upper? Upper or the top side, lower or the bottom side of heart. Okay, so it is all about the heart. Heart is, we are considering heart at the middle of the superior and inferior vena cava. Okay, so the inferior vena cava drain from the top of the right atrium, and it is from the behind of the right atrium. Okay, so in this right atrium, when the deoxygenated blood is come, it will fill the right atrium completely. Okay, so the left atrium receive the oxygenated blood. So we are talking about the atria. So I also uh, add one more line about the left atrium. So here is your left atrium, and it is receiving blood from the pulmonary vein, that is from the lung. Okay, so the from the lung blood is entering into the left atrium, so it is coming from the lung, so it's more oxygenated, and it is coming from the body. So in a right atrium there is a less oxygenated blood. Okay, so the more oxygenated and less oxygenated blood is coming in a different compartment of our heart. Okay, so the right atrium or the right compartment of a heart is famous for the deoxygenated blood, and left side of your heart is always carry oxygenated blood. Okay, so there is a difference between right and left side. So you can also write it in the examination. Left side always had the oxygenated blood, and the right side of a heart always carry a deoxygenated blood. Okay, full atria apply, uh, I mean the when blood enters into the atrium, atria get full, and the full atria apply the pressure in a wall of a heart, and it will activate the SA node, which is a part of our last lecture. Okay, so please see the last lecture. I've already discussed how SA node and the nodal tissue work in the wall of a heart. So what happens when this atria get full? Okay, so let me clean it and change the pen so we can see easily. So this is a possible. Yes, it's visible now. So when this part of your heart get full, it apply the pressure on the wall. Okay, so we know that when you feel water or the liquid inside of a sac, it will apply the pressure on a wall, and this pressure on wall of atria activate the SA node. Okay, so where is the SA node? Let's see. Your SA node is placed at the bottom of the superior vena cava. So here somewhere your SA node is placed. Okay, so this is SA node. It's a sinoatrial node. Okay, we call it a pacemaker. Okay, so we call it a pacemaker. So this is a SA node or sinoatrial node. Sometimes people write it like a SAN. That is SA node. SAN. Okay, so these are the few different or the alternative name used for the SA node. So when the pressure is applied on a wall of a heart, it will activate the SA node at the bottom of the uh, superior vena cava, and this SA node emit the impulses. Okay, now it is radiating the impulses from the a part of the right atrium, and let's see how it is moving toward the different part. Okay, so now there is no any issue with the atrium. So because of SA node, your atria or the both atrium get contracted. Contraction means what? We can call it the systole. Okay, so your both atria are now in systolic condition. What is meant by systolic? Now they are in a contracted condition because of the contraction into the atrium wall due to the SA node. So SA node is responsible for the contraction of atria only. Okay, so contraction of atrium only and not ventricles. Okay. Okay, so we have question, guys. Who supplies the oxygenated blood? So here is your pulmonary vein, which is supplying oxygenated blood from the lung. Okay, so in last two slides, we are talking. We will definitely talk about this question. Okay, now you can see here is a pulmonary vein at the right side of your screen. You can see this pulmonary vein is going to enter into the left atrium, which is carrying the oxygenated blood because it is coming from the lung, and we know lung is famous for the exchange of air, I mean exchange of oxygen and CO2. So the CO2 is move out of the body and oxygen is come into the blood. Okay, because of this uh, lung. Okay, so the anything which is coming from the lung or the any blood pipe which is coming from the lung, uh, so it is full of oxygen. Okay, so see here what happened due to the activation of SA node. Why SA node is activated? Okay, so when your atria is full, atrium is full, it apply pressure on a wall. Okay, full means full of blood. Okay, atrium is full of blood, it apply pressure on a wall, so this pressure get activation of SA node. Okay, and then the emission of a signal or generation of impulse and this impulse move through the wall of atrium. So these impulses are now running through the wall of atria, and due to that it get contraction of atrium. Okay, so the contraction of atrium is called as systole. It is called as systole. So what happens when the contraction of atrium is there? It will push the blood into ventricle. It will push the blood into the ventricle. Okay. So this is the sequence by which the blood is coming inside of the atrium and again enter into the ventricle. So guys, please write it like the way I write it. Okay, so this is the way you can make a notes. Okay, atrium is full of blood. It applies the pressure on all, and then the wall which is in under pressure, they activate the SA node. Because of the pressure, SA node generate the impulse, and because of that impulse, now all of atrium is contracted, and because of that, the high pressure which is applied on a blood automatically open the. So here is a contraction of atrium. Contraction of atrium having two things. One is a push the blood into the ventricle, and second thing opening of a wall. Okay, so it is also very necessary. Opening of wall. Opening of a wall which is placed between the atria and the uh, ventricle. Okay, so that wall is called as a tricuspid wall at the right side, and the a mitral wall or the bicuspid wall at the left side. Okay, so there are two compartment, so two wall are there. So guys, uh, your one friend is asking me about the conducting system. So पाटील कंडक्टिंग सिस्टम जी आहे ती मी लास्ट लेक्चर मध्ये शिकवली. ओके, so this is the second part of our heart and circulatory system. If you do not have the detail about the conducting system, you can see the my second lecture also. Okay, so definitely it will help you. Let's see. So generation of impulse, contract atria, atrial systole causes a pumping of blood into the ventricle. हा पाटील समजायसारखे आहेत लेक्चर, तुम्ही पाहू शकता पहिलं लेक्चर माझं हार्टचं, आणि उद्या एक एक्स्ट्रा लेक्चर ठेवलेलं आहे हार्टचं. ओके, संध्याकाळी 7 वाजता, तर तुम्ही संध्याकाळी पण येऊ शकता 7 वाजता. ऍक्च्युली संध्याकाळी लेक्चर ठेवायचा प्लॅन असा होता की हार्टचे जे डिसीजेस आहेत, सो देर इज अ डिफरंट टाइप ऑफ वर्ड्स वी यूज फॉर अ हार्ट, लाईक हार्ट अटॅक, arrest. Okay, so myocardial infarction. So what are the this type of diseases, and is there any difference? Okay, तर या सगळ्या गोष्टीसाठी मी उद्याचं लेक्चर ठेवलंय. आणि दुसरी महत्वाची गोष्ट म्हणजे मोस्ट ऑफ द पीपल ऑलवेज राईट opposite when they ask when there is a question in examination, like write about the when they always write it like something atria, sorry, the artery. Okay, so the lecture is about the artery and vein. There is any difference, or the conduction system of artery and vein and the capillary also. Okay, so this type of the very good information that is mostly having a one question from the informative part. So it will definitely we will cover tomorrow. Now we are in the mood of the concepts today. Okay, so we are moving through the concepts today. So backflow is prevented by eustachian wall. So that there is a chance of a black flow. So black flow means it is moving toward the again a vena cava. Okay, and the pulmonary vein. So the this type of backflow is guarded by the different wall. So we have eustachian wall which guard the veins, and Thebesian wall which guard the coronary sinus. Okay, so the veins are guarded by the eustachian wall. So in the last lecture I already explained the which wall is placed at the which point, and how it works. Okay, so here is how it works. At the time of a contraction, these two wall get closed. Okay, so these two wall get closed. So at the time of a atrial systole, these walls definitely in the closed form. Okay, so atrial systole takes a 0.1 second. Okay, atrial systole takes a 0.1 second, and a diastole takes a 0.7 second. I already revealed that it takes only 0.8 second to complete your one beat. Okay, so there is no point to discuss about the things how it get convert and how it takes 0.7. We have a graph about the um, atrial and the ventricular systole and diastole. So now you have to keep in mind that 0.1 second for the atrial systole. That systole means uh, for the atrial contraction, and 0.7 second for the atrial relaxation. Okay, so when you write it like a relaxation at the in the bracket, and here is also after systole or before systole, please write a contraction. Otherwise these words are most of the people feel like it's a confusing and they got confused. Systole means a relaxation or the contraction. Okay, so it is necessary to write it like a uh, systole and in bracket contraction, diastole in bracket relaxation. Okay, so let's see what happened in ventricles. Now in a last slide, what happened, the SA node get activated, the contraction of atria and blood is enter into the so here is blood which is enter into the ventricle. Okay, now the blood is into the ventricle, so we are going to see how the blood from ventricle to enter into the two things. One is a lung, so one is moving toward the lung and one is moving toward the body. Okay, so the impulse started from SA node, reaches at the AV node. Let's see where is the AV node placed. So your SA node is here at the bottom of your uh, superior vena cava. Okay, so this is a SA node, and here is at the bottom of your atria. Okay, so the atria is going to end here. So at the bottom of your atria uh, we have one more node, we call it AV node. We call it a AV node. So this AV node or AVN, sometime AVN or AV node. Okay, so this N stands for a node. So when the signals from the SA node move toward the different part of right and left atrium, that time the signal enter into the AV node also. We know this SA node is called as pacemaker. Okay, I already write it there. So this AV node is called as a pacemaker. Okay, so let's see guys, pulses which are coming from the SA node is not going to enter into the ventricles. Okay, so why? Because there is a long distance from the SA node to the ventricle, and it required a specialized system to move the signal through the wall of a ventricle, and because of that we need the spacer here. So from the spacer we have the bundle of his and Purkinje fiber. Okay, so in last lecture, so who don't know, the guys, if you don't know, please see my last lecture. It was about the things like this, how they move from the one point to the another point. And because of that, what happened, when AV node get activated, it will signal toward the uh, a Purkinje fiber, and Purkinje fiber is spread all over the wall of a ventricle, and that's why there is a contraction due to the impulses in a wall of a ventricle, and the blood is pumped out of the ventricle in arteries. Okay, so now let's see, from a right ventricle it is a pulmonary artery, and moving toward the uh, lung. Okay, so the pulmonary artery, from pulmonary artery, blood is moving toward the lung. So this is a pulmonary artery. One side is moving toward the one lung, and the second side is moving toward the second lung. So here is your side of a pulmonary artery moving toward the second lung. So okay, so it's a right lung and it's a left lung. And this left ventricle, from the left ventricle blood is entering into the aorta, and we know the aorta is a first pipe which is coming from the left ventricle and moving toward the body. Okay, so the aorta is the largest artery, we considered it. uh, Cuspid wall get close and stop the backflow in the atrium. So where are the cuspid walls? Let's see in the diagram, guys. So here is your tricuspid wall, and here is your dicuspid wall. Okay, so we call it like a mitral wall. So they both wall are placed at the end of the atria and the initial part of the ventricle. So it is between the atria and ventricle, which is responsible for avoid the backflow or the leakage from the ventricle into the atria again. Okay, so they are very necessary to avoid this type of backflows. So the a closing of the cuspid wall results in the sound. We call it a lub. Okay, we know the sound of a heart is a lub dub. So the lub sound is because of the cuspid wall, which is placed at the atrioventricular end. Okay, so the lub sound is because of the closing of a cuspid wall. Do not guys, do not write only cuspid wall. Write like a close or the closing of a cuspid wall will make the noise or the sound which is like a lub. Okay, ventricular stroke takes ventricular systole takes 0.3 second, and the diastole takes a 0.5 second. Okay, so the in atrial we know it's a 0.1 second and it's a 0.7 second, but now ventricle take a more time for the systole and less time for the diastole. Okay, so at the time of a ventricular diastole, so the diastole is also I written here because I want to uh, add the line about the dub sound. Otherwise, it is difficult to understand the why dub sound is there. So we know the lub sound is because of the cuspid wall get closed uh, at the time of or the when signal moves from the AV node toward the wall of a ventricle. Okay, so here the semilunar wall which close and guard the pulmonary trunk. Okay, so the pulmonary trunk means the pulmonary artery which is moving out of the right atrium, and the first part of the artery we call it a pulmonary trunk. And the aorta is the largest artery which is coming out from the left ventricle. So these arteries are the guarded by the walls. Okay, so these semilunar walls are always in the closed format. When ventricle get contracted, the automatically blood come out of the ventricle by these two pipe, and the wall which is closed or always in a closed form of this artery which guard the artery is automatically open, and the opening of the wall make a sound. We call it a dub. Okay, it heard like a dub. Okay, so this is how the lub and dub sound comes from. The lub is because of the cuspid wall get closed, and the dub is because of the semilunar wall get open. Okay, so a joint distol is there. So guys, it is not because of the open, it is just because of the close when the ventricle get empty. Okay, so the when blood is complete move out of the ventricle, that time the semilunar wall always again the guard your ventricles, and that time they again get close, and it makes sound like a dub. Okay, so let's see. Me पहिल्यांदा शिकवताना ना चुकून मी ओपन बोललो, त्यामुळे मी परत सांगितलं ती गोष्ट. ठीक आहे. So here is your joint diastole. So what is meant by joint diastole? If you see the atria, it takes a 0.1 second for a systole. Okay, and 0.7 second for a diastole. If you see the ventricle, okay, it's a atria and it's a ventricle. And now it take 0.3 second for the systole, and 0.5 second for the diastole. Okay, so now we know, here we can see, there is definitely the patch or the time which is the common for the systole and diastole, or the which we can say the it is for 0.7 second and it is for 0.5 second, and if you see it takes a 0.8 second complete, it takes a 0.8 second complete, but the common part for this 0.8 and 0.8 is a 0.4. Why the 0.4 is a common? Because at this point the both atria and ventricle are in a diastolic form. Okay, in a diastole. Why it happens? Let's see. In 0.1 second, atria get uh, contracted, and 0.3 second a ventricle get contracted. Okay, so the because of that what happened, there is a 0.4 complete time for the contraction of atrium and ventricle. So the relaxation for the atria and ventricle required 0.4 second, and that's why the timing of the one beat is considered as 0.8 second. Okay, because of the 0.4 second is already engaged with the contraction, and the remaining time is a 0.4 second, which is common for the both atria and ventricle for the relaxation. That means there is a few seconds, or the fraction of a seconds present inside of the heart, where the both, I mean both means a four compartment, four chamber of heart are in relaxed form. Okay, total four chamber, all four chambers are in the relaxed form, and it is for the 0.4 second, and this the relaxed form chambers we call it a joint destroy. Okay, we call it a joint diastole. Okay, so why it is called a joint diastole? Because both atria and ventricles at the time of joint diastole, atria is also in a relaxed form, and your ventricle is also in a relaxed form. Okay, so that's why we call it at joint diastole. Okay, how is the sound form? Okay, so what happens when the blood is moving inside of the ventricle and the outside of the ventricle? That time the closing and the opening of the wall like this. Okay, it makes vibrations, and that vibration results into the sound. Okay, so there is, we know if you pour the water into the another uh, a pot, it make a noise, it make a sound. Okay, so that's like that our heart is also making a sound, like a zero, like a lub and dub, and it is because of the opening and closing of walls and moving of blood. Okay, so see guys, this is the graph. Okay, so it is from your book also, your this time this year the new book is very good in the sense of a graph and the diagrams. Okay, so and there is also the column or the uh, uh, squares with a different color. They are very beautifully written. Okay, so if you do not read this type of stuff when you study, please start it studying. Okay, so more spend more time on the brackets, like or the color part of your page. Okay, because the most of the time the questions are coming from there as it is. Okay, the single line is coming from the that part having one word missing, and that word you have to find in the option. So this is how they ask you, like fill in the blank. Okay, so from that area also. So something interesting or the this type of headings are there for you. So please always read that stuff, and spend more time on that. Let's see. So here is your graph. This graph represent you the diastolic and the systolic time of the atria and the ventricle. Okay, so it's a atrial systole, it's a ventricular systole, it's a ventricular diastole, it's a atrial diastole. Okay, so the as per our discussion, let's see, atrial systole, it takes a 0.1 second, and atrial diastole it takes a 0.7 second. Okay, now for ventricle, 0.3 second for ventricular systole and 0.5 second for ventricular uh, diastole. Okay, so total 0.8 second, total 0.8 second. But now let's see from the 0.4. Okay, why 0.4? Because the ventricle is now in a systolic, that means a contracted form for 0.3 second, but from 0.4 to 0.8. Okay, so the total 0.5 second, it is in the form of the relaxation, we call it a dilation. At this point, the atria and ventricle both are in the relaxed form. Okay, so the both atria and the ventricle relaxed form. Okay, and this is called as a joint diastole. Okay, so we called it a joint diastole. It is about a 0.4 second where all compartment of your heart is in a form of a relaxed or the diastole. Okay, it is too much easy to understand and keep in mind. Okay, easy to mug up also, but I will not recommend you to mug up the things. It is very logical thing. If you see the 0.3 second, it is in the, it is engaged with the systole. So obviously from 4 to 8, it will enter into the diastole, and after 8, it will again enter into the systole. That is a 0.1 second. Okay, so that time it is enter into the systole again, and same here from the 0 point after 0.7 and this 1, that means 0.8 second. The 0.9 second is nothing but the 0.1 second of your second heartbeat. Okay, and it will again enter into the systolic form. Okay, so this is how the heart uh, alternatively contract and relax, and we called it the rhythmic contraction and rhythmic relaxation, and generally we call it a heartbeat. And if you see the medically, it is a cardiac cycle. Okay, so this is your cardiac cycle. This is your cycle of a heart. Okay, let's see yeah, from the diastole, the relaxation of a heart. At the time of a joint diastole or the relaxation of heart, you can see the complete heart is busy with having or the taking a blood from the different part. Okay, so this is taking a blood from the right, sorry, it's a left side of a heart, so it is taking a blood from the lung, and this part is taking a blood from the body. So it's a less in oxygen, it's a more in oxygen. Okay, so now both blood enter into the ventricle at the time when atria enters into the systole. Okay, so it is moving like this. Now when atria into the systole, you can see the blood is now completely enter into the ventricle, and your ventricle having a pressure on a wall, and that time the SA node and AV node are working for the signals. Okay, like this, and they are having a Purkinje fiber here on the wall of a heart. And because of that, what happened? Because of this wall of a heart and having a different type of Purkinje fiber on it, it causes impulse movement of impulse from the AV node to the wall of a ventricular heart, and it causes a contraction of ventricles, and due to the contraction of ventricle now blood is moving toward the uh, arteries, and here in a final stage this contraction is called as a ventricular systole, and you can see here the walls are moving inside of the heart, and due to the less space the pressure is applied here, this wall opens and your blood is moving out of the uh, heart. So the from right side of your heart blood is moving toward the lung, okay, and from the left side of your heart blood is moving toward the body. So this is how the systole and diastole of blood or the heart is work like this, okay, with the help of the impulse conduction system. So if any of the atrial or the ventricle systole or diastole changes its time or the gets late to complete the happens. Okay, so this is the question. So question is from your friends. So guys, what happen if there is a late or the uh, atria or ventricle is not taking its signal at the exact time? So the guys, what happen in this situation? Actually the time of heart will change, okay, so the your 0.8 second is now not 0.8 second, okay, so it is now changed, and this change always have symptoms or the consequences on our body, but we have different type of controls, okay, so these controls started the normal conditions, okay, started making the normal conditions, and after a few time or the after a time you can see the heartbeat is now again 0.8 second, not less and more than the 8 second. If you see the here it is either more or either less than the 0.8 second. So in the a day our heartbeat changes from 0.8 second to the 0. Sometime more or sometime less by the different reasons, okay, due to the different reasons. Sometimes we uh, operate to something, sometimes we are happy, sometimes we are sad, and these all things always control your heartbeats, okay, so heartbeat may change, it doesn't matter, but when you are at the rest the heartbeat again move toward the 0.8 second. That's why I always told you okay, whatever I return in a bracket is a very important at rest. I already written there at a rest, okay, so heartbeat may be changed. We know that when we are in the uh, inflammation or the fever, or we have the any disease or infection, that time our heart rate also changes, okay, a doctor always check it for a heart rate, okay, they check here impulses, this impulse or the we call it a pulses, okay, so this pulse uh, uh, is measured on the artery, we call it a radial artery, okay, so it's a radial artery at the wrist, okay, so this is nothing but the checking of your heart rate, okay. No, actually, this is not a situation which make a problem, but it's a adaptation. Actually, it's a adaptation. When you are afraid or you have a fear about the thing and you are trying to run, that time your heart having a more heart rate as compared to the normal, and that time you can move faster because of the fast supply of blood toward the body or the muscles, and that's why you can move faster, okay, so it's just adaptation, it is good for health, okay, but when you are normal and still your heartbeats are moving toward the 72, 75, 80, or moving toward the high values, so that is not normal, it will be problematic for you, okay, so there is a consequences for the change in heartbeat, and it is also necessary for to change the heartbeat, okay. Let's see the regulation of heart activity. So in the activity of heart, uh, we know heart is a myogenic. We already discuss it. Why it is myogenic? Because it has a nodal tissues, okay, or nodal cells. The two patches of a nodal cells, we call it a SA node and AV node, they are responsible for the control of a heartbeat. Okay, so control of heartbeat. But still, it is a myogenic, still it is a control of the two system. Okay, so your heart is under control of a two system. One is a chemical system and second is a nervous system. Okay, so there are two systems. One is a chemical and one is a nervous system. These are both system involved in the heart or the activity regulation of a heart. Okay, let's see guys. So the under control of autonomic nervous system. So this is a cardiovascular center. The autonomic nervous system or the nervous system had its cardiovascular center into the part of a brain. We call it a medulla. Okay, so it is uh, the part of a brain stem. Okay, with the bones and other there is a hypothalamus and thalamus is also. So in few book it is written like a 3 part and in few book it is written like a 5 part, but the most of the scientists is said that it's a brain stem is made up of a 5 part. Okay, so the medulla and the bone is also there. So the medulla is act as a center of the cardiovascular activity. So the control of a heartbeat in a response to the input from the receptor. So which type of receptor are involved in the input for the control of your heart? So the proprio receptors, this receptor monitor the position of limb and muscle. Okay, so let's take an example. If you are doing an exercise, that time the more movement of the your limbs and the muscles, it will activate the nervous system, and nervous system release epinephrine and norepinephrine. Okay, so the epinephrine and norepinephrine as a neurotransmitter. Neurotransmitter, it will result in a high heart rate. Okay, so the proprioceptor which monitor the position of the muscle, it monitor the you are doing the hard workout, that time the heart rate automatically increase because of these proprioceptors. Okay, then chemoreceptors, it monitor the chemical changes in a blood. So due to the changes in a blood, it will result in the change in a heart rate also. Baroreceptor, it monitor the pressure, the stretching of artery and the main vein. Okay, so the main artery and main vein, when they get a stretch, there is always a change in the regulation of heart activity. Okay, so there is always a change in the activity of heart. So we have the second, that is a sympathetic and parasympathetic nervous supply. So in the sympathetic nervous supply, there is epinephrine, which is a neurotransmitter, work like the same. The monitor which monitor the position of a limb like a proprioceptor. So it is work like the same. Epinephrine as a neurotransmitter. Okay. So in the parasympathetic nervous system, acetylcholine is there. So here in the sympathetic nervous system, heart rate increases. But in this system, the heart rate decreases. So the heart rate is going to decrease here in a parasympathetic nervous system because of acetylcholine, it's an inhibitor. Okay, so let's see the chemical control. So in the hypoxia, acidosis, and alkalosis, the your cardiac activity decreases. That means heart rate decreases. Okay, and the cardiac activity increase in the response to the hormone like epinephrine and norepinephrine. So in the last slide, uh, I called it epinephrine and norepinephrine, but as a neurotransmitter. Now we are talking about the epinephrine and norepinephrine as a hormone. Okay, so the epinephrine and norepinephrine also act as a both. They are a neurotransmitter as well as a hormone. Okay, so guys, do not get confused. Now here they are a hormone. So epinephrine is also called as adrenaline, and norepinephrine is also called as noradrenaline. So these hormones are coming, both are coming from the a single part of a body, that is adrenal gland, and Adrenal gland is looks like this. Okay, so this is a cortex of adrenal gland. Okay, it's a cortex and its medulla. So from medulla, these two hormones are secreted. Okay, so from medulla, only two hormones are secreted from the adrenal medulla. One is adrenaline and second is noradrenaline. So this adrenaline and noradrenaline are synthesized from dopamine. Dopamine is look like this. So this is your dopamine. Okay, if you this is a dopamine. We know dopamine is secreted by pineal gland. It is synthesized in a different part of the body. Okay, so if you add OH here, it's a noradrenaline, and if you add CH3 here, it's adrenaline. Okay, so the dopamine to synthesize adrenaline, dopamine is first converted into the adrenaline, noradrenaline, and then adrenaline. It is synthesized into the medulla of the your gland, which is adrenal gland, and that's why the hormones are called as adrenaline and noradrenaline hormones. Okay, so these hormones prepare our body for the emergency response. We call it emergency hormones. Emergency hormones. They prepare our body to face the conditions like a horrible. Okay, so it prepare our body to face the flight and fright response. We call it a flight and fright response. Most of the time, scientists call it like a triple F response. One is for a flight, okay, to jump from somewhere to the another part. So it is for fear. Second one is a fear. Fear means if you got any trouble and you have to run, that time you require this adrenaline and not adrenaline in your blood, so that the heart rate will be increased for the more than 75 or more than 80 sometime. Okay, and the last one is for a fight. Okay, so it is for a fight. So sometime it is called as a triple F hormone. Okay, so these are the adrenaline and noradrenaline, which increases, they both comes together and to increase the heart rate. Okay, so this is how the heart rate is controlled by the a different type of chemical and the nervous system. Here is the elevation of sodium and potassium in a blood automatically decrease the heart rate of our heart. Okay, so this is a circulation in our body. So in detail we will see tomorrow, but it is just introduction to you. So this part is moving toward the lung. This part is moving toward the lung, so it is called as pulmonary circulation. And the circulation which is moving toward the body, we call it a systemic circulation. Okay, and the blood circulation in the heart. Okay, so here is a circulation of blood uh, in the wall of a heart. This circulatory system which is supplying blood to the heart is called as coronary circulation. So we have a total three circulation in our body. We will going to discuss it tomorrow at 7 p.m. Okay, so the lymphatic system, so it is a part we are going to discuss tomorrow also. Okay, so after our circulatory system we will discuss about the lymphatic system. Okay, so guys, if you do not have subscribed the channel, please subscribe the YouTube channel, that is Crack Maharashtra CET, and you will have the notifications and other type of lectures on this channel. If you do not have the subscribe, do not have joined this group, join it for the daily updates. Okay, so see you at 7 p.m. today with a growth of a plant. Okay, so we have a lecture at 7 p.m. Like it's a growth of a plant or plant growth. So let's see how the plant is a grow and what are the processes and stages involved in the plant growth. Okay, so thank you very much and thank you for supporting me. Have a good time.